And I want to hear about the idea of Dr. Lim. Do you think what are the advanced treatment for lung cancer?
I'm a medical oncologist, so I use drug to treat lung cancers. So drug treatment in cancers, traditionally we call it chemotherapy. So these are just a general term for drugs against cancer. Traditionally we associate chemotherapy with hair loss, nausea and vomiting. But we know that nowadays we have, number one is the side effects of chemotherapy is much lower. The reason is the drugs are better, they give less side effects. And second, just as important reason is nowadays the supporting medications are much better. We have much better medications to reduce nausea, we have medicine to reduce risk of infection, to reduce risk of reduced immunity. And also the drugs, the chemotherapy drugs are more effective. But chemotherapy, we realize that they can only do so much. And nowadays we have newer treatment, systemic treatment. For chemotherapy, we have been using the same chemotherapy for the treatment of lung cancer for the last 20 years. The current drugs that we use, chemotherapy drugs that we use for lung cancer treatment was first developed about 20 years ago. But we realized quite soon that we could only do so much with chemotherapy. And the next breakthrough was targeted treatment. Targeted treatment means with better understanding of the cancers, we realize that we can identify the genetic change that make the cells turn cancerous. And once we know that, we can design drug that targets specifically the genetic change, so that to stop the cancer growth. The first targeted treatment for lung cancer actually came up in about 2003, that's what 12, 13 years ago. So these drugs are typically tablets. So it's one tablet a day, and what we found out is if using the right drug with the right patient, they are much more effective than chemotherapy. And at the same time, they have very little side effects because they target the cancer cells and sparing the normal cells. And without it being a tablet, there's no need to go to the cancer center, the clinic once every few weeks for infusion. So now this targeted treatment is one of the main pillars for the treatment of lung cancers. And the chance of control is much higher than chemotherapy, and the duration of control is much longer, provided we can identify the genetic change in the patient, in the lung cancers, and we can use the correct medicine. But targeted treatment is not applicable to all lung cancer patients. In about 50 to 60% of lung cancer patients, we can identify the genetic change that led to the cancer formation, and in others, we could not. So these targeted treatment not applicable. Although we say targeted treatment is much better, higher chance of control, duration of control, ultimately they cannot cure. So the patients, although they have long good control of the cancer will eventually come back and become resistant, and new treatment will be required. So the third breakthrough actually occurs in the last 1 to 2 years. We call it immunotherapy. Immunotherapy just means using the own body immune system to control the cancers in the body. In a normal healthy person, the cancer doesn't develop because any cells that turn abnormal, cancerous, it will be destroyed by the normal immune system. But we now know that cancer can through many ways. Number one, they can evade the immunosurveillance. They can hide themselves from the immune attack. Number two is some of the cancers through various mechanisms, they can suppress the body immune system so that prevent the body immune system from attacking the cancer cells. We have been toying with immunotherapy for years, for decades. Some of the common things that we have been doing is cancer vaccine. We use vaccination for infectious disease. We get hepatitis B vaccination, hepatitis B. These are effective. We have been trying to use cancer vaccine to stimulate the body to attack, to control the cancers, but so far not a lot of success. We have also been toying with the ways to stimulating the body white cells by harvesting the patient's own white cells or T cells, stimulate them in the laboratory, making them more effective towards the cancers and putting them back into the body. Until quite recently, we are only be able to be successful in a very small number of patients. For the last 2 years, immunotherapy is, we are very enthusiastic about it because of this mechanism called PD-1. We now understand in some cancers, especially lung cancers, they can avoid the immune system or they suppress the immune system by expressing the protein called PD-L1. So this PD-L1 will suppress the body immune system. So nowadays we have monoclonal antibodies. We can make monoclonal antibodies that attack or specifically the PD-L1 to remove the inhibition, to remove the suppression on the body immune system by the tumor, making the body immune system recognize the cancer cells again. Yeah. So this field has been developing very fast for the last 2-3 years, and it has been shown that immunotherapy, anti-PD-1 antibody, compared to chemotherapy is more effective. And so much so that this group of drugs has been approved for the second-line treatment in advanced lung cancer for the last 1 year plus. And just 3 days ago, the same group of drugs has been approved by the USA for the first-line treatment in lung cancers. The good thing about immunotherapy is, number one, it offers us an additional mode of treatment. We have chemotherapy, we have targeted treatment, now they have additional treatment. Number two is it has very little side effects. So it can be applicable to patients who are weak, who are older, with other medical conditions. And the third thing is, although the response rate is not very high, in general about 20 to 30% of patients will respond to immunotherapy at the present time. But for those who respond, the response can be very long, much longer than chemotherapy and longer than targeted treatment. So we have an additional mode of treatment which is effective, much less side effects, able to control for a long time.